So sure enough, like a couple of days before the grand opening of my very first location, I got this big packet in the mail from their legal office
Cease
saying
and desist.
within like 48 hours.
Holy
so
cow.
Here I am. I have my signage. Everything's ready to go. And I had to hurry up and think of a new business name. And so one night we were laying in bed and all of a sudden my husband's like, how about Pulse?
Hello, everyone, and welcome to Sounds of Health, where every week we discover inspiring stories, meet incredible people, and share valuable resources to help you boost your physical, emotional, and financial well-being. I'm your host, Dave McNiven, and I'm thrilled to welcome our guest today, Ana Uva. Ana is a board-certified family nurse practitioner and the founder of Pulse IV Therapy, now with multiple locations in Connecticut. Ana, welcome to Sounds of Health.
Thank you. Thank you for having me. I'm happy to be here.
Yeah, we're so excited to have you here. So this has been a long time coming, I think. So
yes.
I've been trying to get you on the show for almost a year now, I think.
Life has been crazy.
Yeah,
There's
you've got a lot going on.
Office and the baby. So here we are. I'm so happy to be here finally.
That's awesome.
Yeah.
Well, I'm really excited for our listeners to learn about you and about the great work that you're doing with Pulse IV Therapy. Your first location for that was in Hamden, right?
Yeah, Hamden, right along the Cheshire line.
Okay.
We call it the mom and pop shop.
The mom and
That's where it
pop
all
shop.
started.
Nice. And then how many locations do you have now?
So we're at 3 right now, with the goal of continuing to expand so we could hit multiple communities.
Amazing.
Yeah,
That's really incredible. So we're going to talk all about that and how long it's been for you in business and what it is that you offer. But I would love to get started with just hearing about what your story is and kind of where you came from and what brought you to what you're doing now.
Yeah. So, I started in school for nursing, became a registered nurse. I graduated in 2015 from Southern Connecticut. And from there, started directly as a new graduate in the medical intensive care unit at Yale. So that was a huge learning curve because intensive care, I mean, you learn your foundation in school, but you don't really learn those high critical skills until you get into the workforce. So quite a long orientation, and I loved it, and I miss it still. But you're dealing with, intensive, critical,
high pressure situations.
high pressure situations.
Yeah.
So you have to have that little adrenaline piece that you like to it because you never really know what you're walking into. But I love that, and I stayed there for about 6 years. And while I was in the, we call it MICU, the medical ICU, I went back part-time for my master's in nursing. Always knew I wanted to kind of excel a little bit more in my career. So went back to Southern to obtain my master's degree. And I did that part-time all while working full-time in the hospital.
That's amazing.
Yeah, that was fun. That was like 7 days a week, which is, I feel like my life anyway. Graduated.
Well, as a business owner,
now, it's 8 days if we had 8.
Yeah.
Graduated that in 2019. And then I actually went from medicine to surgery and I started working in plastic surgery. And still, as soon as I made that transition, it was like new onset COVID was hitting and ICUs were getting jam-packed. So I actually left plastic surgery for a little while to go help support the ICU teams because it was a designated COVID ICU and people were so sick and they were so short-staffed. So I went back there for a few months to help them. And it was kind of during that time, maybe a little prior, where I was getting burnt out. I was seeing very, very sick patients, patients who kept coming back with the same illnesses. Sadly, some of them not getting any better. And it was almost a burnout after 5 years, you start to burn out a little bit.
I bet, yeah.
So I started thinking about more, I'm like, why are these people, they're coming in so sick. Why are we not preventing any of this? And a lot of it was diabetes and heart failure and kidney injury, things that ultimately, not always, sometimes genetics are involved, but ultimately with a good healthy lifestyle and diet and exercise, a lot of it could have been prevented. So that led me kind of to researching preventative healthcare and coming down this rabbit hole of vitamins and minerals and how all of these play a role into your health and how important they are. And that's when in 2020, I started the business and opened the first brick and mortar in 2021.
Amazing.
Yeah.
So you sound like somebody that just doesn't get tired or exhausted.
I do. Yeah. I feel like I've been babysitting since I was 12 years old. It started the workforce. So then from there, continued on.
Gotcha. So you're always doing something.
I'm always doing something, and you enjoy it. I feel like the less I do, the less I want to do, but the busier I stay, the more I can do and the more I want to do. You kind of get into that flow state.
Yeah, definitely. Did you always see yourself in healthcare, or did you ever have kind of another dream?
Yeah.
For, when you were a kid?
Good question. To be honest, I wanted to be a writer throughout like elementary, middle school.
That's
I loved
awesome.
writing.
Yeah.
And then high school came about, and it was my older sister who she works in healthcare, and she's not a nurse, but she's like, you have to be a nurse. I don't know why. She's like, it has stability, job stability. She's a big mentor in my life.
Yeah. So
I was like, well, screw it. I'm going to go be a nurse. And with no intention of working in healthcare, became a nurse. And I'm so happy I did now.
Yeah. Because I can see that.
Yeah. It's a very broad field. And, as a nurse practitioner, there's so much you can do. You could work with kids. You could work in surgery. You could work with adults. Like, it's so cool.
Yeah, it makes a lot of sense, I think, for your sister to have kind of recommended that for you, because even just doing this podcast, we've had a number of nurses on the show that are all doing very different things within the nursing field.
Yeah.
And there's just so much opportunity and so many different ways that you can take what you're learning and do something that you love.
Correct. Yeah. Yeah. And you know what? If you don't like one field and you get a little bored, then you could transition. So the sky's the limit with that.
That's really fantastic. Mm-hmm. Are you still writing at all?
No.
No time for
I'm
the
actually
writing.
a horrible writer now.
Come on.
Yeah,
That's
I'm not.
impossible.
I don't have. I will say I feel like I've lost a lot of that creative skill.
Yeah, you're out of practice.
I'm out of practice.
Yeah.
I'm left brain now, I think.
Yeah, it's a muscle.
Yeah.
So, it's there for you probably when you want to go back to it, though.
If I could just sit and have, we
just
talk
gotta
about
get
like
through the blank
vision days,
page.
right?
Yeah,
I can't just sit and there's too many to-do lists.
Yeah, I can only imagine.
It's not good. But
yeah, because you have now a young family as well, too, right?
Yeah, so in 2024, I had my firstborn, and she is adorable. Her name's Mila. But during that time, I also opened my third location. So imagine that was quite a year.
That's amazing.
Yeah, it was fun. She was a newborn, and we were bouncing around and bringing her to the office to get the furniture all together and doing all the things before grand opening. So it was super busy. She was involved in all of it. It was great.
Yeah, that's so cool. It's nice when you can do things and incorporate your family into it too, career and family life, because it's hard to have a separation between the two, especially as a business owner.
Yeah, certainly. And I mean, I look at it where I'm lucky that I have the flexibility in my schedule where I could do a lot of my work from home. And although it's hard because you're almost doing that full-time mom job plus your career, from home, it's challenging, but I'm grateful for that because it's hard to imagine going to work 40, 50 hours a week where I have to physically be somewhere and without her.
Yeah.
And I know, unfortunately,
really
most families, that's the situation and it's hard.
Yeah, definitely. I changed my career because of that, because I was missing out on time with my kids.
Yeah.
I was working in nonprofit for a while, and it was, nights and weekends, and I was missing out on things that I knew I only get one chance at.
And the time flies. They all say the time flies, but holy crap. Yes, it does.
Yeah.
So yeah, that guilt, I think that parent, I always say mom guilt, but it truly is a parent guilt when you're away from them.
Yeah. And even it's more than just the guilt of not being there. It's just the desire to be there and not miss out on it.
Yep. Yeah. I swear, if I'm like out for instance, today, I'll be out all day and that's okay. I'll be home this evening.
Yeah.
But I feel like tomorrow she learned a new skill already. I'm like, where are you getting this from?
Yeah. At that age, it's every day, right?
Yeah,
like it's just fast. My kids are teenagers now. So, it's a little, they
slow down a little bit.
Slows down in the skill development area. Everything else continues at a high pace though.
Yeah. It's true.
Yeah. So you really kind of got out of school and got into your career. COVID hit. You're in the healthcare field. And thank you so much for all that you did during that time. It's really important that we had our healthcare workers taking care of us and really, fighting on the front lines of that pandemic. But how did you realize? So you kind of shifted your interest into this IV therapy and vitamins and nutrients. How did you realize it was going to be something you can do as a business?
So, truthfully, I didn't think it was something I could do as a business. I kind of started out like family and friends, and it was me in a bag, and I had my vitamins and my fluid in there, and I got certified in vitamin therapy, and I started going to friends and family's houses and giving them these infusions. And I was still working full-time in plastic surgery. So I would go after my shift and I'd be out on Fridays, sometimes I would be out until 10 p.m. and I would go from house to house, and it usually takes an hour to infuse the person. So I'd spend an hour with each person. And that lasted for a little while. And then I said, you know what, I need one spot to see all of these patients, at the same time, because now this is just a little bit wasteful. And I actually rented space from a physical therapist who, Becky, for a little while. So I rented a few chairs from there.
Oh, I didn't realize that. I probably heard that, but I forgot.
Yeah. So great. She's wonderful.
Yeah,
and that's
she's
where it kind of all started. And then got my first brick and mortar, like I said, in 21. And all of a sudden I would sit there on my days off because, again, still full-time in the hospital. So I would 2 days off a week. I would sit in our Hamden office by myself for 10, 12 hours. And I'd be lucky if 1 or 2 people came in the door.
Yeah.
So it's very humbling. I mean, you have to put the time in. But before I knew it, there's so many strangers coming in for our services. And it was just the best. I'm like, wow, I think I have a full-blown business here.
That's amazing.
Yeah.
So it really wasn't the goal of having a business that you set first. It was really the action of doing what the business is first.
Yeah. The vitamins and the things. And honestly, COVID, as horrible as that time was, I think a lot of people became more health conscious.
Yeah.
And more literature started coming out on, hey, these patients who are vitamin D deficient are getting really, really sick. Like maybe this goes to play. There's a huge important role for vitamin D. So that kind of, I felt that there was a need.
Yeah.
So that helped.
Yeah, absolutely. I mean, I don't remember ever hearing about this type of therapy before COVID, but then after coming out of COVID, I feel like now you hear about it all the time.
Yeah. So the vitamin infusions and vitamin injections, I feel like they're big in Florida and Las Vegas and California. And a lot of people think of it like your hangover cure. You're going to go get your banana bag. You're going to feel great, which is true. But it's so beyond that. We barely do hangover cures. It's more people who have comorbidities or aren't feeling well and are tired and fatigued every day. So we see them and we help them a lot.
That's really amazing.
Yeah.
So now you're in 3 locations. How big is your staff?
So I have 12 nurses, registered nurses, amongst the 3. And then we have 2 receptionists currently, and an administrator who helps with like our social media marketing. So, continuing to grow, we are always hiring and finding more staff because it is to fill the 3 locations is a lot. I often play the role as a nurse still, especially on the weekends, which I love. I love being the nurse, but in terms of
But you don't have the time to do that, right?
It's the time. The time is tough, but it's fun because I get to see all my patients and I'm there and I'm caring for them, which is awesome. But otherwise, I'm the overseeing. I'm the medical director and I'm consulting all these patients for the 3 offices. That's
incredible.
Yeah.
Now, how did you decide on which locations to go into?
Oh, man. So I'm not a business person. That's not how, I have no business background. I don't have family in business. So this was all very new to me. And to be honest, I'm good at healthcare. I'm good at caring. But I have no strategy in terms of where I'm opening locations. My realtor will vouch for that because I'm just like all over the map. I tell him when I'm ready to go and he's like, where do you want to look? And I give him like all different geographic locations. But I think I just base it on where I find the spot, which is horrible.
Really?
And everyone keeps telling me go to West Hartford and go to Fairfield County, which maybe that'll be next. But Middlebury is close to home. My husband drove by and he was like, this looks like a great spot. And I said, you're absolutely right. So we opened there. I opened there, I should say. But Hamden, again, I drove by, I saw a little office. So it really, horrible. It's not the right way to do it, but it's working.
It's exactly. You can't say it's the wrong way to do it if it's working.
Right. It may not be the wrong way either. So, and I think these are great because these communities that there isn't a lot there and there is a need for it.
Yeah.
And so it's been great.
Absolutely. And who came up with the brand? I love the logo and the design of your locations. I think it's really excellent.
Thank you.
Who did you have do that?
Oh man, I have to give my husband all the credit, Rick. So he was in doing marketing. He's not a brand developer or really he's not a graphic designer, but he's very talented at it.
Obviously. Yeah.
So actually I came up with Revive when I first started the business. I opened my LLC and I said, oh my God, I'm a business owner, I have a business name. And it was Revive. And I didn't realize, I didn't do any research then. I didn't realize Revive is this huge franchise of IV therapy. So sure enough, a couple of days before the grand opening of my very first location, I got this big packet in the mail from their legal office
Cease and desist.
Within 48 hours.
Holy
so
cow.
Here I am. I have my signage. Everything's ready to go. And I had to hurry up and think of a new business name. And so one night we were laying in bed and all of a sudden my husband's like, how about Pulse? And I gave him, what I imagined for the business was very gender neutral. I wanted men to be just as comfortable as women to come in. Really all demographics to be comfortable there. So I knew that. And then I wanted to, I think everything starts with our cells and our DNA and that health. And I'm like, I want it to be sciencey in a sense. So that's a little bit of where our logo came from, the triangle with the DNA.
Yeah.
And then pulse heartbeat. I mean, we can't be here without our heartbeat, without our pulse, right?
Yeah.
So I love it. And when he said it, I'm like, I think that's it. The name's Pulse.
Fantastic.
Yeah.
Well, he did a great job with that.
He did a great job. I'll give him credit. Yeah.
Nice. Awesome. So let's dive in a little bit as to what you guys actually do, because we've talked around it a bit and we know that it's these infusions, the vitamin and nutrients, but tell me about all the services that you offer.
Yeah. So vitamins, like we said, and minerals and antioxidants and all those things, we often take them orally, and we can take them orally. The biggest difference is even with the healthy gut, the absorption's probably 50%. So it takes a while to optimize those vitamin levels. And when it comes to we always look at labs and we reference labs, and we do micronutrient testing to get a baseline. And oftentimes we go to our doctor and, our B12 and vitamin D, it falls within normal limits.
Right.
And normal limits really just means like an average of the population. Well, most of the population isn't that healthy. So I don't want to be average. I want it to be optimal. So I started kind of diving into micronutrient testing and really getting these ranges on the optimal level. And the faster way to do that is through when it's administered directly into the bloodstream versus an injection into the muscle as well. Is a much quicker way to replete those levels. So that we offer that. We also do hormone replacement therapy. So patients, for men and women, we start to lose our hormones in our 40s. There's a reason why we feel good and we look good and we're energized, and feeling our best in our 30s and before that, right? And then we get to these 40s and we start to feel more tired. We can't keep up on our day-to-day. Maybe we're depressed. Oftentimes it's a lack of hormones. So that's your testosterone, estrogen, progesterone. So repleting that has, my patients night and day, they come in, they're tired, they're almost falling asleep in the chair. Then they start hormones and a month later, they're like coming in, makeup's done, they feel great.
Wow, that's amazing.
Especially our menopausal women. Yeah. So I think there's a big need, and I'm glad, I think now more than ever, people are talking about hormone replacement therapy. And I think it's so important.
You hear about it a lot lately.
Yeah. So we do a lot of that. And then what else? Heavy metal testing. So we have patients who we're all exposed. Our environment, unfortunately, makes us all exposed to these toxic metals. And it's fine. We know we have them. They all hide in our tissues, but it's when you become symptomatic and you're having these funny symptoms. I've had patients, for instance, one patient who came to me and she was so smart. She did her own research, but she's having all these symptoms of brain fog and numbness and tingling in her extremities and headaches. And she wasn't feeling well. So she went to the emergency room and they actually checked her mercury because she advocated for that. And sure enough, her blood mercury was through the roof. And the ER doctors were like, well, we don't really know how to treat that, which no one's fault because we're not really taught this in school.
Yeah.
So she was sent to her primary care, and primary care, same thing. He's like, yeah, it's elevated, but where do we go from here? And she found Pulse, and we did more testing and we did urine testing, and we found that sure enough, chronic and acute exposure. So her mercury was through the roof for quite some time. So we chelated her and we provide this IV chelation. It is FDA approved for
What is chelation?
It's basically it's an agent that binds to these heavy metals, and it pulls them out of your tissues and you excrete them through the urine. We make sure your kidneys are healthy because they're excreted through the kidney.
So is it an injectable? Something that they're injected with? Okay.
Yeah. So they sit with us for about an hour and a half, maybe 2 hours.
And it's extracting the heavy metal from the blood stream and then being excreted.
Correct.
Okay.
Yeah. So it does bind, it extracts metals, but it could also extract vitamins and minerals. So we make sure we include all that in the bag as well. It's a huge investment of time. We're chelating you maybe 10 rounds, maybe 20, maybe 30. So this one patient, I think it took 28 or 30 sessions, and then we finally got her. She was feeling much better and got this mercury out of her. But it's kind of thinking outside of the box, a lot of what we do. And, what are we missing? Are your vitamins and minerals optimized? Are your heavy metals through the roof? And we need to chelate you. And unfortunately, the real only way to get rid of these metals is through chelation. You could sweat them out, but that's like Olympia sweat. If you're an Olympic athlete and you sweat all the time, all day long, you may rid them through that, but otherwise it's very challenging.
Where do you find in a situation like that where the exposure is? Like how are they coming to you that way?
Yeah, so we do a detailed intake of like their history. Where do you live? Do you live in an old building? Did it used to have lead paint? Did you have mercury tooth filling? So there's a number of things that could be raising these metals. Are they drinking their well water? Maybe it's contaminated. So we kind of have to dive in and dig through that. And unfortunately, if we don't find that source, I could chelate them all I want, but eventually once we stop chelating, it's going to keep coming up. Yeah.
Yeah.
That's a huge part of it.
Okay. That is amazing. I haven't heard too much about that before. So you're really doing all of it. Now, when it comes to the IV vitamins, on your website, there's the IV and then there's the booster. Can you explain the difference between the two?
Yeah, we always call boosters, assuming that people know it's just horrible. So booster is generally just, we call it a booster. It's just a quick shot. So our IVs, typically you're sitting with us for about 45 minutes up to 2 hours, depending on what we're giving you. Our boosters are just intramuscular injection. So it goes in the deltoid or the gluteus muscle.
Okay.
And that we could give you many vitamins. So vitamin B12, vitamin D, there's certain vitamins that we could give you into your muscle, and it's a nice dose and you're still going to absorb it well because it's not passing through that entire GI tract. But if you're in and out and you only have like a minute or two and you want to get a little energy boost, you come in for a vitamin B12 and generally patients feel good.
Gotcha. Now I'm sure you have patients who really don't like the IV, like putting it in their arm.
Yeah.
So is that maybe an alternative if they're okay with a little
Certainly, yeah.
booster and stuff?
Yeah. I do like the IVs because I could put a lot higher concentration of vitamins into your bloodstream than I can into your muscle. There's only a certain amount of volume I could put into your muscle, which limits us a little bit.
Yeah.
But we have a lot of needle phobia friends.
I'm sure.
I've had patients come to me and they say, oh, we're here because we have a needle phobia and we want to beat that. So we're here. And I'm like, all right, you're going to faint, but we're going to put your legs up. We're going to prevent it. So it's hysterical. Yeah. I'm happy they trust us with it.
Well, at least they're in a comfortable place.
They're comfy. We tuck them in. We give them coffee, water,
amazing.
all the things, snacks. So yeah, they're very comfortable. And our nurses are really, really awesome. I'm so lucky to have them.
That's really great.
Yeah, very talented.
Did I see also that you have some sort of compression therapy as well that you do? So tell me a little bit about that.
So we have the Normatec boots. They're very popular, I feel like, in athletes and they're lower extremities. So they kind of look like these big old snow boots.
Yeah.
You zip them up and recline and you have your legs elevated and they just compress. So they fill with air and they feel rather tight. So there's different levels that you could set it at to your comfort, but basically it helps with lower extremity perfusion. So if you're an athlete or you're working out in the gym a lot or you're on your feet all day, it just helps with muscle recovery because it brings that blood flow.
Oh, that's
you can almost think of it like when you go into a cryo chamber.
Yeah.
Everything kind of vasoconstricts and squeezes and then it all dilates and you have all that massive blood flow coming in and helping with healing. So it works a little bit like that.
So they must feel much different when they get out of it and they stand up? You can really feel the difference?
Yeah, so I wear them too as often as I can, and I almost feel like I'm walking on a cloud after wearing them for 30 minutes. Yeah, it feels good.
That's great.
Yep.
Okay, so it sounds like you guys are doing so much, which is amazing. How are people coming to you? Like when should they call? When should they reach out?
Yeah, we have such a variety. Everyone always says, like, what's your target population? Who is this best suited for? And the honest answer is anybody. So we have patients who are healthy and they just want to get ahead in preventative care. And they're just like, I need something that I could do that's going to help me feel better and just be optimized in there. Typically those patients, I have them come in on a monthly basis as opposed to we have patients who are fibromyalgia or have multiple comorbidities and they want to feel better. Then they start weekly and we kind of treat them a little bit, or I should say we provide this therapy a little bit more aggressively. So we'll have them come weekly for 3 to 4 weeks. We kind of build up those micronutrient levels, optimize them, and then have them come in on a monthly basis from there.
So it's really based on what the person's situation is.
That's exactly it. Okay. Yeah. Back in COVID, I feel like we had a lot of long haul COVID symptoms, patients coming in with that. So we would definitely see them once or twice weekly for a while.
And this type of therapy would help them with that?
Yeah. Actually, NAD, there's more and more studies coming out with NAD, which is amazing. I don't know if you're familiar.
NAD, no.
Nicotinamide adenine dinucleotide. But
that's a mouthful.
If anyone follows Joe Rogan, he talks about it a lot on his podcast. Yeah. Okay. But NAD is great. It's a coenzyme of vitamin B3, but basically what these scientists are finding, it's kind of like your longevity enzyme, and it works by acting, not to get too sciencey or geeky on you here.
Oh, please do.
But basically, we have these little strands that hang off our DNA called telomeres. And as we get older, these telomeres start to shorten. So what these scientists found was that the shortening of these telomeres was leading to age-related disease. So that's your dementia, Alzheimer's, heart disease. So they then found in studies in mice that NAD, giving you back your NAD, because we all have it in our bodies, and every year it depletes by 1%. So by the time we're 50, our NAD is depleted by 50%. But replenishing those levels is helping lengthen those telomeres again. So it leading to less age-related disease.
That's amazing.
Yeah, but then you feel good. You feel like more mentally focused, less brain fog, more energy. So you feel really, really good with NAD.
Yeah, that's a plus for anybody.
Yeah, for sure. So that's a big one too.
That's awesome. So I have like so many questions behind all of it, but really kind of the next thing that I want to talk about a little bit is just, what your plans are for the future. So you have these 3 locations. Do you see yourself getting bigger?
Yeah, that's the plan.
Yeah.
I will say, the goal was to continue expanding much quicker. However, I had a baby, and now I'm like, all right, pump the brakes a little bit. So truthfully, not that it set me back, but it did slow me down a little bit, which is great. But the plan is to continue expanding and opening more offices and getting out to these different communities. Because I think we have something very unique, and our nurses are excellent and they're knowledgeable, and patients feel very comfortable coming to us and they trust in us. So being able to provide that service to more communities is the goal.
And is there something that sets you apart from some of the competitors that you have out there?
Yeah, I think there's a couple of things. One is our big competitors are the big franchises. I'm very involved. I mean, a lot of those are owned by just business people and not medical people. From what I'm realizing, I'm the nurse practitioner. I'm the owner, and I am very, very involved. So, I mean, day to day, my nurses could text me anytime, any day, and I'm there and available to talk to these patients. So we could customize right on the spot. We have a walk-in patient and they have multiple comorbidities and they need a custom bag rather than just our set protocols. I could customize that for them. I find that we put a higher concentration of vitamins. So I think that's something important to ask when you go out for these IV vitamin services or intramuscular booster shots is what are the doses you're giving me, and making sure you're getting what you're paying for, because the whole point is to optimize your levels. So we want to make sure we're giving you proper dosing. And most of these vitamins being water soluble, so you really won't overdose on them, which is great. They're very safe. And then just our customer service, my nurses, and that's safety and customer service is what I preach at our team meetings, and my whole staff knows it. And man, do they excel.
That's great.
I think most people, if not everybody, leave happy. And I really care how people feel. So just making sure they have that experience, and it's just so awesome. We're very positive vibe and pulse, and I think our patients will definitely vouch for that. They come in, they're not feeling good, or they're having a bad day mentally, physically, and they leave feeling better. And that, even if it's just mentally, they leave happier.
So you're establishing a culture.
That's what it is.
And across all of the different locations. Yeah.
And the cool part is the nurses love working in that kind of environment.
That's amazing.
It's so awesome. Yeah.
Now, when somebody does come in and they have a consultation, are you guys doing the testing and the blood work yourselves, or are they coming to you with their results from their primary care physician? How does it work?
Good question. Yeah, it varies. So I have some patients who, actually a lot of patients come from naturopathic doctors who do great testing, lots of testing, and will recommend supplements. And sometimes it's too many oral supplements for their GI tract. So they'll refer them, or the patient will find us, and a lot of that can be combined into a vitamin bag instead of taking all of these oral supplements.
Oh, wow.
But other times we'll have patients come in and they just want to inquire and they're wondering what their micronutrient levels are. So we could do the blood work right in the office. Sometimes I'll send labs out to Quest, so they go get their own labs. It depends on what we're testing.
Okay. And does that go for the hormone replacement therapy as well? Are you doing that? Okay.
Yeah, I'll do all their hormone lab testing. We do quite a comprehensive panel initially. I want to check their liver, kidney function, their electrolytes, their hormones. So we do a comprehensive test, some vitamin levels with that, and then we come up with a nice plan for them.
That's awesome.
Yeah.
So you're developing kind of a game plan for them to follow?
Correct.
And so does that include follow-up blood work and follow-up tests to see where it's going?
Yeah, for sure. So definitely the hormone patients, usually 4 to 6 weeks after starting them, I will follow up blood work, check in with them. I like blood work because I like to just, let's make sure that the medication is effective. But most important for me is, how are you feeling? If you're not feeling better and your blood work says you're a little better, then it's not good enough yet. We may need to titrate your dose to make sure that you actually feel good. Because a lot of what we're managing when it comes to hormones is their symptoms. They've been tired and depressed lately, and we want them feeling better. So I don't love to chase blood work. I have it there as a reference, but I don't love chasing that number too much.
That's interesting.
Yeah.
That's really, and it's probably different what you're seeing than what they're getting from a primary care physician or someone that's in the field. Yeah.
I love traditional medicine. I work in it still. I still work at the hospital. But there's also a time and a place. So then there's alternative where we're thinking a little bit more outside the box, I feel, and coming up with different ways to make these patients feel better, and more so on that preventative side.
That's awesome. So tell me a little bit about how somebody gets started. What's the first step for someone? Then what does it look like when they come in? Yeah.
Are we speaking of all services or just hormones? Or
yeah, I guess broadly, kind of all services.
Yeah, honestly, it all starts with a phone call, and our receptionist is wonderful, and we'll walk you through depending on whatever you're looking for. A lot of patients ask if they need a doctor's note or clearance before coming. No, that would be, I would do the consultation and the clearance and make sure it's safe for you. If there's patients who have a significant kidney disease or something, I may have them get clearance from their nephrologist, because we do all work as a team. But otherwise, I do the clearance. So they call in our phone number, and the receptionist will greet them and schedule them. So usually it's either telehealth or in-person consult with me, depending on what they're looking for. And that often happens if it's they're coming in for vitamin infusions or vitamin injections. They could just do that the same day that they come in. So it's a very simple process for them. They don't have to kind of get clearance from me and then come in. We do it all on that same day, same visit. So as soon as I speak to you, you could go sit in the chair and infuse that day. Okay,
that's great. Yeah. So there shouldn't be any barrier for somebody reaching out and just getting started and seeing if it's right for them.
Correct. Yeah, we make the whole that was another goal, is just to make it pretty seamless of a process.
Yeah. Yeah. That's awesome. So you had mentioned too that you're not a business person. Obviously you are, but you didn't go to business school. But you have been a part of the Entrepreneurs Organization, correct?
Yeah, I love it.
Yeah. So you and I, that's how we met initially.
Yes.
And we've had a few people from the program on the podcast recently. How has that program been for you?
Oh, so great. Honestly, I really didn't know. I didn't know business owners prior to this program. I didn't really have many mentors or anybody to kind of seek that business advice from. And then actually the one mentor I was so lucky to have met was the one that introduced me to EO and said, you have to join. So sure enough, I did. And you're just surrounded by like-minded people. And it's interesting to see that their problems are your problems. And we kind of we share very similar situations.
Yeah. No matter the industry.
No matter the industry. And you always think, I'm like, how can I help this person? Our industries are so different, but there's always some similarity, which is so cool. But it's been, I would say, life-changing for the business. It just helps you learn systems and structure, and you need protocols and all these things in place, where before that, a standard operating procedure is I didn't even know what that meant before I started EO, to be honest with you.
Yeah, you and me both.
Yeah. So they, I feel that it's been life-changing, and I'm still a member, and I think I'll be a member for quite some time.
Yeah, that's awesome. And it's, as you grow too, I feel like those systems that they're always preaching just help you to do it.
Yeah. That's the only way I could have the 3 offices and have them flow, and I could be here today, and, I know everything's going well. So yeah, it's I'm very thankful for it.
That's awesome. How do you find your nurses and the people that are actually working for you?
So typically, I will get, they reach out to me, and I'm finding lately in the past couple of years, I think since COVID, a lot of nurses are looking for jobs outside of the hospital. They are getting burnt out.
That's for sure.
And these hospitals are short-staffed, and they're always looking for help too. But I'm lucky in the sense that these nurses often reach out, and they'll send me an email, or they'll reach out in some way to Nicole or I. So we have a lot of resumes saved on file, and when we're ready to hire, we kind of shuffle through those. We've gotten really good at our interview process. So, I'm lucky. I have just the best team right now.
Yeah.
I really do. They're just smart, and they're personable, and it's just everything. And that's, skills can be taught, but luckily they all come with those skills, because a lot of them have full-time or part-time jobs in the hospital, or they're coming from full-time or part-time jobs. Yeah.
Well, it says a lot about you and the culture that you're building.
Thank you.
Because that's how you find those people, is you've established kind of your core values and your priorities, and it doesn't happen by accident.
You're right. It really does. The core values have been great. And just reminding everybody why we're here. We're here to take care of these people and make them feel better. It's so rewarding.
That's great. That's awesome. Well, I do encourage a lot of people to check you out. I talk to people about you all the time in the business. I know it's going really well, and I wish you all the best as you continue to expand.
Thank you. Yeah, we're excited. I'm excited.
Yeah. So the last thing we usually do, because I don't want to take up too much of your time, I know how busy you are, is we always ask our guests to leave our listeners with just one tip that they use in their practice of daily health. And it can be something that helps you to be healthier physically, emotionally, or financially. Do you have any tip that you can leave our listeners with?
Yeah. I will say in my daily, one is exercise. And I'm sure a lot of people say that, but it is so important, not only for your physical health, but also mental.
Yeah.
Our stress level, I think, is always a 10, at least mine is, but we learn to manage it. And I think exercise has helped me manage it a lot, even if it's just a walk. If you hate the gym, you're not going to go to the gym. So don't do that. Maybe you like dancing. That's exercise. That's great exercise. So finding what you love to do physically and doing that, I think it has a huge benefit for mentally as well. Financially too. I think we could all get a little better at saving, and I think I've
that's for sure.
gotten much better at it, and just making good investments, and I don't know, being financially smart and not needing to buy every designer bag, or just learning to manage those finances and save a little bit, I think is helpful. I think everybody in America could use a little bit more of that. So
you just reminding yourself of that, or is there something that's helping you in that process?
So I think I've just learned, I will put money into a separate account, and that's not here. I pretend it's not even here. And that's helped me manage finances better.
Yeah.
Versus if I am going to use that money, it's going to be an investment back into the business. How can I make the business better with it?
That's great. So you're separating some of it, so it's not so readily available to use on things that you don't necessarily need.
Don't keep it all in a checking, because then you feel like you could just go, spend it all, and that's just not right.
Yeah, that's great advice.
Yeah.
What are you doing for yourself for the exercise? Is there something that you enjoy that helps you go?
Yeah, I like the gym. I do like to lift weights, and then Soul and Body in Cheshire. So they offer yoga and Pilates, and it's so close to my house, which is very convenient. And the instructor is fabulous. And I started doing that. And I feel like it really brings that mindful piece into it. Cause the gym, I have either a podcast on or music, and you're kind of lifting and you're at a different mental space. But when you go to yoga and you're just like resting and breathing, it's very relaxing, but also a heck of a workout.
Oh, I bet.
Yeah.
That's awesome.
So I try to do both.
That's great.
Yeah.
That's great. I recently, this year, kind of got back to the gym myself and got into a routine.
Nice.
And I was never really a gym person. There's been times in my life where I've gone, but it was never consistent. And something shifted, like something's changed. And I think that's something I think people should realize too, is just because you didn't like it at one point in your life doesn't mean that it's not going to work for you at another point in your life.
Yeah.
So to, keep trying it.
So true.
Find what you like.
And those first 2 weeks of anything are the hardest, especially getting back. And you're sore, you're hateful, but once you get past those 2 weeks, it gets addicting.
Yeah, that is very true. And then it's a matter of just consistency. Just show up.
Consistency. Yeah. I think we kind of beat ourselves up. We're thinking like, we need to lift this much as soon as we go back. We need to do this much. But no, a brisk walk goes a long way. Start slow.
Yeah. And anything's better than nothing.
Anything's better than nothing. Yeah.
Right.
Yeah. So.
Well, great. That's all really good advice, and we thank you for that.
Thank you.
Thank you so much for your time today and for being on the show. I'm glad we finally got you on here.
So happy to be here.
And next time you're going to bring Nicole back.
Oh yeah, it'll be don't miss out on that one. It'll be a little sideshow. It'll be fun.
Absolutely. So let's make sure that's not going to take another year. We'll get you back in sooner than later.
We would love that. Perfect.
Right. Thank you so
Thanks,
much, Ana.
Dave.
Really appreciate it.
Thank you.
Okay, well, that's a wrap on another episode of Sounds of Health, brought to you by Nutmeg Insurance Advisors and recorded at the offices of Nutmeg Advisory Group. Sounds of Health is produced by Jason Carubia with music by Rob Hames. I'm your host, Dave McNiven, and every week we bring you stories that inspire, empower, and help you to upgrade your health and life. If you enjoy the show, be sure to like, share, subscribe, and leave us a review. Do all those things out there to help us get the word out. Don't keep us a secret. We love hearing from our listeners, and we hope that you all continue to be an important part of our wellness community. Thank you for listening. See you next time.